Anal cancer is a rare but important cancer to know, with its diversity stemming from the complex composition of the tissues of the anus, including the anal canal and the anal margin. This particular anatomical region has various epithelial structures, which explain the variety of tumorous types observed. Although this cancer is often neglected or diagnosed late, early recognition is essential for effective management. Anal cancer are primarily divided into two distinct categories based on their location: the tumors of the anal margin, which develop from the skin tissues surrounding the anus, which are similar to common skin tumor, and the cancers of the anal canal, which are predominantly squamous cell carcinoma. The early diagnosis of anal cancer relies on an evaluation of medical history and clinical symptoms. There are so many risk factors that can contribute to the development of the anal cancer. Some risk factors include women over 65 years old, homosexual men, and men around their 40s, and people living with HIV, as this population is more exposed to HPV infection, a major risk factor. Symptoms are often non-specific, complicating early diagnosis. Among the most frequent manifestations, we find rectal bleeding, which is a common symptom, especially during defecation. However, it is often wrongly attributed to other conditions, delaying the correct identification of the disease. Fissure syndrome, with a localized pain at rest or during defecation, sometimes associated with itching. Hemorrhoidial syndrome, with symptoms similar to hemorrhoid may present, but they generally resist the conventional treatment. In some cases, a palpable mass in or around the anus or in the neighboring tissues may be a sign of a malignant tumor. These signs, although frequent, are often ignored by patients due to the fear or embarrassment about consulting a doctor. When it comes to physical examination, generally any anoperineal lesion with an undulated character should be considered highly suspicious of malignancy. The digital rectal examination is an essential exam which helps to specify the height of the tumor, the potential extension in the relation of the anal margin, and the possible invasion of the lower rectum or surrounding structure. Inguinal lymph nodes should always be palpated to check for any adenopathy, which may indicate tumor spread. And for women, a gynecological examination with the cervical smear is performed to detect precancerous or cancerous lesions of the cervix associated with the anal cancer. And for men, a penile examination aims to check for HPV-related lesions. After that, a general examination to search for any signs of metastatic spread, including the palpation of the supraclavicular region, which may reveal enlarged lymph node or adenopathy, possible sign of metastatic involvement. When it comes to paraclinical examination, three essential things to do: endoscopy, which is a fundamental step to directly examine the affected region and perform a biopsy. This allows for visual assessment of the anal canal and the rectal region. Any lesion identified as suspicious should be biopsied. The sample is then sent for histopathological examination, which is the only method to definitively confirm the diagnosis. Computed tomography or CT is a key imaging examination that provides precise information regarding the exact location of the tumor, the size and the local extent of the mass, and the anatomical relationship with the neighboring structures, which is essential for planning therapeutic management. And finally, viral serology, as some viral infections are associated with anal cancer. So specific serology are performed, including HPV or human papillomavirus, as the link between HPV and squamous cell carcinoma of the anal canal is well established. Identifying this virus can confirm an etiological risk factor. Another serology, HIV serology, particularly in patients at risk, as the immunosuppression linked to HIV increases the susceptibility to anal cancer. After the positive diagnosis, it is essential to stage anal cancer. This staging allows for assessing the local and general extent of the disease to plan appropriate treatment. The thoraco-abdominopelvic CT or TAP CT is a reference examination as the first line. It locates the tumor, measuring its size, evaluates its anatomical relationships with surrounding structures, and identify a local region extension such as lymph node invasion, and detect metastasis in distant organs including the liver, lungs, or peritoneum. A magnetic resonance imaging or MRI is particularly indicated for tumors of the anal canal, especially those located near the sphincter. These examinations provide detailed information on the depth of the tumor extension and its relation to the internal and external sphincters. After that, we have endorectal ultrasound, which is used for evaluating mobile and non-stenotic tumor. It measures the transwall extension, meaning the infiltration of the different layers of the rectal and the anal walls, and search for any local lymphadenopathy. Depending on clinical needs, other complementary examination can be performed. Hope this information will be helpful to you, and we will talk about the treatment and details in the following videos. If you like this video, the best thing you can do is subscribe to the channel. Thank you so much for watching till the end, and I'll see you in the next one.